What's up, everybody? In this video, we'll be talking about communications questions on USMLE. Many of you have heard that communications questions now make up the bulk or the supposed majority of ethics questions on step one. And despite knowing that, it's still very overwhelming to try to tackle this topic because you see the answers in different quotes. A lot of them sound really good. A lot of them sound like things that a reasonable person would say, and it becomes really difficult to pick the correct answer, but there actually is a formula to follow if you want to get all of these questions right. So in this video, I'm going to tell you about that formula and help you work through these questions so that instead of it being really challenging, it'll end up just being free points. If you like this video and you want to contribute to my channel financially, please click the join button. The join button can be found underneath every single video on my channel. It's also the first link in the description of any video on my channel. And when you click that join button, you'll sign up to be a Dirty Medicine member, which means that you'll pay $4.99 a month to support my channel financially. I really appreciate your consideration. Now in this video, like I said, we're going to talk about communications. And the first part of communications questions is to understand where the test writers are getting their information from. And basically what this comes down to is that the test writers want you to pick the answer that's most patient-centered. So patient-centered care refers to the concept of maximizing healthcare outcomes for the individual patient in front of you. Everything that you do needs to be centered and geared toward that individual patient. And patient-centered care really is the culmination of a few factors. Those are cultural, environmental, and systemic. So as you might imagine, patients come from a variety of different backgrounds. They have a lot of different expectations. They respond best to certain aspects of care, and they might respond poorly to others. And it's the job of the physician to integrate all of these various factors and come up with the model of healthcare that maximizes the healthcare outcome for that unique person right in front of you. So with that in mind, when you get a communications question on USMLE, you need to pick the answer that's most patient-centered. So what's the formula for this? Well, there's a three-step process for how you go through communicating with patients on exams. Step number one is you want to form a connection with the patient. And the way that you would do this via communication is the following. So you might use reactive empathy and reactive sympathy. You're going to restate the patient's concerns. You're going to note their emotions and validate all of their fears, anxieties, etc. So step number one, you should be thinking which of these answers forms the best connection with the patient to really establish my care being patient-centered. And the way that you do that is by restating everything that they're telling you to point out how they're feeling. Once you've done that, step two is you want to attempt to understand why. This is a biggie on USMLE. They're going to give you some scenario, some ethical scenario that is in some way controversial. Maybe the patient is refusing a life-saving treatment. Maybe the patient has a religious background that prevents them from getting some type of treatment. And regardless of whether or not the patient is right, regardless of whether or not you agree with them, you simply need to understand where they're coming from and how they're arriving at their healthcare decision. So you gently and non-judgmentally ask the patient why so that you can attempt to understand. The third and final step is to provide the objective information. So at this point, you've formed a connection with them through empathy. You've gotten them to explain why and help you understand where they're coming from. And now you have to give them objective information in your role as the physician. And usually on USMLE, you won't actually be picking answers that do this because the really controversial thing is step one and step two, trying to figure out which of the quoted answers best exemplifies either of these steps. But if you are doing step number three, you need to remember to be objective, to be non-judgmental, to be non-biased, and to give them all of the medical information as a normal person would want it. Okay? So these are the three steps of being patient-centered. And when it comes to questions on USMLE, they're going to be tough. It's going to be hard to pick between answers. So what I want to do is go through some examples of communications questions. I'll point out the right answers, and then we'll talk about why individual answer choices are incorrect. And in doing so, I'll highlight which of these three steps those answers are exemplifying. So they'll be color coded. So if it's light blue, it'll be about empathy and connecting with the patient. If it's light red, it'll be attempting to understand why. And if it's light green, it will be about providing information to the patient. So let's get started. A 29-year-old female who works as a food worker in a hospital cafeteria comes to your office seeking guidance about the COVID-19 vaccine. She states that she does not want to get the vaccine because, quote, "You can't trust those damn chemicals. I could end up with either a developmental disorder or that clotting problem. It's just poison and I don't need it," end quote. Which of the following is the most appropriate initial response? A, I understand your concerns. We have ample data which have all concluded that COVID-19 vaccinations are very safe. B, can you explain to me why you feel that COVID-19 vaccinations are unsafe? C, I have vaccinated hundreds of patients and not one has experienced a single side effect. D, vaccinations can be a very frightening topic. E, COVID-19 vaccinations are entirely safe. Would it help if I printed you out some materials to read? All right, so pause the video if you want to think about which of these answers is the most appropriate initial response. Here we go. So the correct answer in this case is D. Vaccinations can be a very frightening topic. So let me highlight what each of these answers is doing. Again, I'm using the colors here. So the first step is you want to form a relationship with the patient by either showing empathy or sympathy. So you want to restate their concerns, let them know that you understand how they feel. And in all of these answer choices, only choice D is doing that, right? It doesn't matter that the patient thinks that vaccines cause all of these problems. It doesn't matter whether or not you agree with them. You need to try to form a relationship with this person by acknowledging how they feel. And the only answer choice that does that is choice D. Choice B sounds pretty good. Can you explain to me why you feel that COVID-19 vaccinations are unsafe? But if you lead off with that answer as your initial response, you're missing the step where you use empathy and reflective listening to establish a relationship with them. And you might imagine that if you were in that scenario, it's like you're immediately questioning what they're saying. You don't want to ask them to attempt to understand just yet. You need to form the relationship first. So while choice B is probably a good thing to say, you have to say that after you've gained the patient's trust with some type of empathetic statement. Now, both choices A and E sound pretty good, right? You're giving them objective data about COVID-19 vaccination, but that's the third and final step, so you can't choose those as your initial response. And for choice C, that is just clearly incorrect. You never want to compare other patients' care to the care of the patient in front of you. Don't ever do that. That's never going to be the correct answer on USMLE. So again, the point of this practice question is step 1, empathize and form the relationship. Step 2, attempt to understand. Step 3, provide objective, non-judgmental, non-biased information. Never ever compare the patient in front of you to another patient. It doesn't matter. It's never going to be the correct answer. All right, next example. A patient presents to your office for their routine annual physical. You are running behind and unfortunately see the patient 60 minutes after their originally scheduled appointment time. When you enter the room, the patient is noticeably upset and says, quote, "You know, my time is valuable too. You doctors always book people and keep us waiting forever," end quote. Which of the following is the most appropriate initial response? A, I apologize for the delay. I try to spend the same amount of quality time with all of my patients. B, you are upset because I kept you waiting. I apologize and hope you can forgive me. C, I can see you are upset right now. I'm so sorry for the delay. My last patient was talking a lot and I lost track of time. D, I'm sorry you are upset. The unfortunate reality of healthcare is that sometimes appointments run overtime, but it is necessary to spend quality time with each patient regardless of how badly I am running behind. Or E, can you help me understand why you are upset? So which of the following answers is the most correct initial response? Pause the video if you want some time to think about it. And if you're ready, here we go. So the correct answer choice here is choice B. You are upset because I kept you waiting. I apologize and hope you can forgive me. So let's highlight what we're dealing with here. So choices A, B, and C are all light blue, which means that you're empathizing, you're using reflective listening, you're telling the patient how they feel. But the reason that choice B is correct and that choice A and C is incorrect is because if you look at A and you look at C, the part that I highlighted in yellow is not something that you want to say. So choice A, you apologize initially, and then you say something like, I try to spend the same amount of quality time with all my patients. And in C, you say, my last patient was talking a lot and I lost track of time. Both of these answer choices, the physician is making an excuse. And it doesn't matter how legitimate the excuse is. You never, ever, ever make excuses or blame some other circumstance on USMLE. That's never going to be the correct answer. So even if the first part of the answer sounds really good and appropriate, and it's following the 3 steps that I told you about, if there's any excuse or using another situation to justify why you did what you did or why the physician in the vignette did what they did, it's never the right answer. And that's why USMLE communications questions are challenging, because A and C sound pretty good when you first read them, especially choice C. I see that you're upset right now. I'm so sorry for the delay. That part sounds great because you're identifying their emotions, you're empathizing, but then you blame your last patient. So choice C is clearly incorrect. Likewise, choice A, you're making excuses. I try to spend my time, I try to spend the same amount of quality time with all my patients, and it's never going to be the correct answer. Now, choice D, let's look at this. I am so sorry you're upset. The unfortunate reality of healthcare is that blah, blah, blah. So you're giving them information. And yeah, that's technically true. The unfortunate reality of healthcare is that sometimes appointments do run over time, but the patient in front of you doesn't care. That's not a patient-centered answer. That is getting on your pedestal and lecturing about the reality of the healthcare system. And that's never going to be the correct answer on USMLE. So that's clearly wrong. Choice E, once again, sounds pretty good. Can you help me understand why you're upset? But remember, you've got a patient in front of you who's pissed off. You need to empathize with them and create a relationship before you attempt to understand why they're upset. Also, it's a little redundant. You know why they're upset in this question. You kept them waiting an hour overtime. So you never want to ask redundant or obvious questions. That'll never be the answer on USMLE. All right, so that was the point of that example, and I hope that made sense. Let's do another one. A patient and their family was involved in a significant motor vehicle collision. The patient is stabilized in the emergency department after losing a significant amount of blood. Lab work is completed, which reveals a low hemoglobin. The emergency physician recommends a blood transfusion and attempts to get consent from the patient. However, the patient refuses after explaining that they are Jehovah's Witness and it's against their religion to get the blood transfusion. After empathizing with the patient, which of the following is the most correct statement? A, can you please help me understand why you do not want to get a blood transfusion? B, it's your right to refuse the blood transfusion. C, it is my obligation to inform you that refusing a blood transfusion would be against medical advice. D, we have evidence that suggests when low hemoglobin is not corrected, healthcare outcomes are worse. Or E, I respect your right to refuse the blood transfusion, but you need to sign this waiver. So pause the video if you need some time to think about this one. And if you're ready, here we go. Correct answer here is B. It's your right to refuse the blood transfusion. Now let's go through these answers. So you see here that choices B, C, and D are all giving information. So this is the providing information step. This is the third step in answering questions. And you might be wondering, well, why is choice A not the correct answer? Can you please help me understand why you do not want a blood transfusion? But look at the clinical vignette. They already tell you, the patient already tells you that I'm a Jehovah's Witness and it's against my religion. So they've already told you why they don't want to get the blood transfusion. So imagine this scenario plays out in real life. You've got this patient in front of you that tells you a personal detail about themselves, talks about their religion, does not allow them to get the blood transfusion. And then you say something like, well, can you please help me understand why you don't want to get the blood transfusion? I just told you. So again, if it's redundant, it's never the correct answer. You would never ask that in real life. You would look like a fool because they've already told you. So now we're choosing between B, C, D, and E. Now, choice C says, it's my obligation to inform you that refusing a blood transfusion would be against medical advice. And although that's true, and in some health systems, you might have them sign a form that says they're doing something against medical advice, at first glance, that's not the most correct initial statement because it sounds a little bit off-putting. Choice D, we have evidence that suggests that when low hemoglobin is not corrected, healthcare outcomes are worse. That sounds a little judgmental. Again, it's true. You're providing objective information, but you need to soften the way that you give that objective information. And the most correct statement initially is acknowledging that it's the patient's right to refuse the blood transfusion. And once you reassure them that it's their right and you're not going to overstep your boundaries, you're going to respect their decision, you're going to respect their religion, then later on comes the part where you give that objective information about things that are against medical advice, about worse healthcare outcomes. And choice E is just clearly incorrect. Although the first part sounds pretty good, I respect your right to refuse the blood transfusion, you don't ever go, but you need to sign this. But it's stupid if you refuse it. You never want to say that. You don't want to put buts in these answers. Anytime that the second part changes and does a 180 and sounds pretty bad, it's never the correct answer on USMLE. All right, so that example I hope makes sense. Let's do another one. A patient has a spontaneous abortion after struggling for months to become pregnant. The patient is crying hysterically and is not hearing you when you attempt to conduct your daily encounter. Which of the following is the most appropriate statement? A, I cannot imagine how it must feel to lose a child. B, losing a child must be so difficult. C, I know how much time and effort you put into becoming pregnant. This is a heart-wrenching tragedy. D, I also lost a pregnancy once. I understand how difficult this must be. E, I understand that you are extremely upset right now. Thankfully, you're still in perfect health. So pause the video if you want some time to think about this one. I made this one really tricky on purpose. I'm going to point out a nuance here that a lot of people don't appreciate when they answer these questions. But pause the video if you want some time. And if you're ready, let's roll. So the answer here is choice A. I cannot imagine how it must feel to lose a child. And actually, all of these answer choices are that first step. It's trying to form the relationship with the patient. It's trying to use reflective listening. It's trying to use empathetic or sympathetic statements. And let's go through these. So all of these answers, to one extent or another, with the exception of maybe one of them, sound kind of good. But let's talk about the two obvious ones. Choice D, I also lost a pregnancy once. I understand how difficult this must be. You never, on USMLE, ever want to use personal information about your own history to try to make a patient feel better. That's never going to be the correct answer. So we can cross out choice D. Choice E starts off pretty good. I understand that you're extremely upset right now. So there's the empathy. But then the second part, thankfully you're still in perfect health, it's just inappropriate. So yeah, the patient just had a spontaneous abortion. They are extremely upset. You don't want to say, well, let's look on the bright side. You're fine. Just inappropriate. So that's not the correct answer. So really we're looking at A, B, and C. Now, C, I know how much time and effort you put into becoming pregnant. You don't want to use a patient's history and assume you know what they went through. You never assume. If you assume, the answer is incorrect. So any answer choice that has an assumption, it's not going to be right. So assuming that you know how much time and effort they put in, which you don't, even if they're your patient, just don't say that. That's not the right answer. So now we're looking at A and B. A is I cannot imagine how it must feel to lose a child. B is losing a child must be so difficult. And the difference here is that one is empathy, that's A, and one is sympathy, that's B. So empathy is feeling or not being able to feel what the patient feels. And sympathy is knowing what the patient feels. And when you're choosing between an empathetic and a sympathetic statement, you always choose empathy. So you don't want to come and be like, wow, losing a child must be so hard. That's not a wrong thing to say, but it's not as right as being honest and saying, I can't imagine what you must be feeling right now. That statement, that second one, that is a level of empathy that choice B doesn't have. So empathy, feeling what the patient feels or not being able to feel and communicating that is always better than telling the patient that you see what they're feeling. And that nuance can grab you a couple extra points on test day. So if you're struggling between two answers, ask yourself which one of these answers sounds more empathetic. And that's the point of this question. All right, Next example. A 23-year-old male with a past medical history of alcohol use disorder presents to your office complaining of problems at home with his boyfriend. He states that his boyfriend, who has never been diagnosed with any substance use disorder, has been drinking, quote, too much, end quote, and suddenly he feels concerned that he may relapse and start drinking again after being abstinent for 2 years. Which of the following is the most appropriate initial statement? A. Tell me how your boyfriend's alcohol use affects you. B. It sounds like you would benefit from talking to one of our social workers. C. Your boyfriend should know that using alcohol around you can be very triggering. D. What significance has alcohol played in your life? And E. Tell me how I can help you get through this stressful time. Pause the video if you want some time to think about this one. And if you're ready, here we go. Correct answer here is choice A. Tell me how your boyfriend's alcohol use affects you. Now, some of these answers sound good. Some of them sound pretty bad. So let's go through the obvious ones. So first, we've got, and I apologize, when I put that red box on the correct answer, it's really hard to read the text. But I'll go back in just a second so you can read it. But let's look at choice B. So choice B, it sounds like you would benefit from talking to one of our social workers. That's objectively true information. However, on all of the communications questions, if the answer involves punting the responsibility to somebody else, so like saying you would benefit from a psychiatry consult, or you would benefit from going to the office of a neurologist, or you should talk to a social worker, any of those things where you give the responsibility away is never the correct answer. So although B may be true objectively, it's not correct. C, your boyfriend should know that using alcohol around you can be very triggering. So it might sound like it's a good reflective statement. However, it is very judgmental. Right now, you're judging the patient's boyfriend, and you don't want to do that. So that's clearly incorrect. Now we're choosing between A, D, and E, and I'm just going to go back to the previous slide so you can read the text of choice A. D says, what significance has alcohol played in your life? Choice E says, tell me how I can help you get through this stressful time. So E sounds pretty good. D says, what significance has alcohol played in your life? And the reason that D is not correct is because the patient kind of already told you. So the question sums it up for you. And this is a little bit redundant. So we can cross out D. Although it sounds okay, it's probably not as good as A or E. Now, the reason that E is not as good as A is because E also almost makes it sound like you don't know what to do. So although it sounds somewhat caring and forms the relationship, so to speak, and is sort of like a help me understand kind of question, it's not as good as choice A because you're kind of giving the patient the ability to tell you what to do. And it's almost like saying, I don't know how to help you right now. How can I help you? And that's something that you might say to a close friend. Maybe it's something that a therapist would say, but it's not something that you would say as a communications answer as a physician in an office. And the reason, again, that choice A is the best answer here is because saying, tell me how your boyfriend's alcohol use affects you is like another way of saying, help me understand why your boyfriend's alcohol use affects you. And you give them the opportunity to help you understand why they feel like they might relapse, why they feel like seeing the boyfriend drink around them is causing them all these problems. So again, you want them to help you understand, but you don't want to make it sound like you don't know how you can help them. And again, I'm being very nitpicky here. This is a nuance, but I made this tricky on purpose because you could see this come up, all right? So here's the highlight, and that's it for that example. So that's it for this video. We went through some examples. Remember that we started with this slide. And the reason I'm bringing this up again is because you're inevitably going to get a question on USMLE, maybe COMLEX, where you're answering a communications question and you don't know which one is the right answer. And when it comes to this, ask yourself which answer is the most patient-centered. And bottom line here is that if something, even in like the smallest amount possible, makes you feel like they shouldn't really say that, it's not the correct answer. So the answer has to be the most perfect or the least bad answer. So if there's any little bit in the answer that doesn't sound right, it's not the correct answer. So it has to be patient-centered. And these questions are difficult. Everybody knows communications questions are difficult. They look at choice A, they look at choice D, and they're like, these sound exactly the same to me. Why is one right? Why is the other one wrong? And the answer comes down to one is more patient-centered and the other one isn't. So when in doubt, Ask yourself, if I was the patient, which answer would I want to hear that makes me think the physician understands me best? And that is a good method for answering these challenging questions. Good luck. Keep it up.